would like to ask your both permission to use this video for educational purpose and on internet.
Sure. That's fine.
Tell me about your symptoms before the surgery.
I had a lot of pain in my back, especially when I was walking, and I would have to, I'd walk just a very short distance and I'd have to sit down.
Yeah. How bad was the pain? 1 to 10?
Oh, it could be up to 10.
Okay.
Yeah.
How was your daily life, daily activity?
Now?
No, before the surgery.
Oh, before.
Wasn't.
No, not much of anything.
Not much of anything.
No, just because I couldn't walk and my back just hurt so bad.
Yeah. What did you notice about how she was living before the surgery?
She was doing things, but it was very limited. Very limited. I mean, we even had taken a trip out to North Dakota and even trying to walk out there, and that's a year, no, that's 2 years ago.
Yeah.
2021.
Yeah.
I mean, she could hardly walk.
How long was it like that? 2 years or longer?
Under 2 years.
2 years.
Yeah.
Now, obviously, we did the surgery just about 4 months ago. Is that about right?
Yep. October.
Yeah. And I'm going to just turn around. We did actually a big fusion. And the bone is quite nicely growing. Here in the upper level is still working on it. And in the back as well is working on it. But overall, actually, the bone growth, I'm very happy with that. Now, do you remember the surgery?
Yes.
How long did you stay in the hospital?
I went home the next day.
The next day?
Yeah.
Now, what is the first thing you noticed after the surgery, specifically regarding the leg pain? Tell me about your leg pain that you had before the surgery. How was it right after the surgery and how is it now?
Right after the surgery, I did have some weakness in my left leg.
Okay.
And I had trouble with some tingling sensations.
Let's talk about that.
Okay.
Describe it. Where was it?
It was from my knee down. And something even would just barely touch it.
Would be very sensitive.
It was very sensitive.
Do you remember us talking before the surgery that some people may have something, nerve irritation after the surgery?
Yeah.
What did we talk about? What do you remember?
Just that there's always, you're working around a lot of nerves, and so it can, cause some discomfort for a while. And sometimes it doesn't happen, but it did with me, but I'm doing much, much better. Now,
if you remember, we talked about that 15% of the people have that nerve irritation that usually after a month or two start going away. When did it go away with you, that sensitiveness of the foot?
For the most part, after maybe a couple months.
Yeah. So that was around the same time frame.
Yep. I think that was about right.
Now, how is the leg pain now?
I'm doing really well. I do have some stiffness in my my left leg still and my right, but I'm doing physical therapy and I'm doing much better.
Now tell me about your daily activity. You told me something that you couldn't do before. Tell me about your walking and activities.
Well, before I had the surgery, I couldn't walk very far at all. I'd have to sit down. Just doing things around the house was just difficult. Had pain, I'd have to sit down. So it really did affect my daily living. It really did. And after the surgery and where I'm at now, I'm doing more and more, and I don't have the pain in my back. Excellent. Which I'm so thankful for.
Yep.
Now, what do you notice in her daily activity and how she's living?
She's becoming more independent.
Good.
At first, I'd never realized, the pain that she had and what she was actually doing physically as a wife. When I had to do all those things for her, at the end of the day, I'm tired. I want to go to bed. The worst for her was when that leg swole up. That right leg. Or left leg. It looked like a basketball from her knee down. It had swollen so bad. So. And
sometimes the reason for that is because it's so much in pain. People don't use it. Our leg, what it does, our muscles, when we use them, it pumps the blood back up to our heart. when it's so painful, people just baby it, they don't use it. So that is sometimes indirectly why it swells up if you don't use the leg. But is that getting better, that swelling?
Slowly.
Oh yeah.
Yeah.
Slowly
good.
getting better.
Yeah.
Excellent.
Yeah.
Excellent. So that means you're using it more and more.
Yep.
Now, overall, so far, happy with the results?
I'm very happy. I'm very happy with the results, and I'm very thankful for you.
Thank you.
And I'm thankful for the gift that God has given you
Thank you.
to help people.
Thank you very much. Now, you had lots of very good questions. You will answer them, but I want for people who listen to that, because they may have the same question, that we go over your question and quickly answer them. You want to go one more time over your question?
Sure.
You're well organized.
Yes,
go
I
with
am.
Yeah.
Okay, so my first question was, how long do I need to wear my brace?
So there are two different braces. One brace for stability. We usually wear it about a month for walking, for 4 months when you drive a car. But after that, it's just individually different. You wear it as when your back get tired, and then slowly you wean off it. So it's time for you to wean off the brace and slowly increase the activity to your back. There's another brace, we call that bone growth stimulation, where it gives electronic kind of signal, electromagnetic signal, make the bone grow faster and better. Usually you wear it 2 to 4 hours, preferably 4 hours, for up to 9 months after the surgery, and that make the bone grow just faster and better. You can wear it even over other braces and over your clothing. The electromagnetic wave still passes through and make the bone grow better and stronger.
Yeah. And that was one of my questions, if I still needed to wear it, and I do, which is fine. I still have some weakness in my left leg, but it is getting much, much better. It's much better.
Examine your leg. The strength is full, but the nerves are still irritated, so it's more coordination than actually through weakness. But all of those things are usually within few months after the surgery start getting better. Unfortunately, nerves are one of the slowest healing organ or tissue in our body. They grow as fast as your hair in the head, about an inch a month. Meaning sometimes it takes a long time for those nerves to recover and come back to life. One of the signs that the nerves are waking up is sometimes people tell me they get these jolts at few seconds. Can you describe them for me?
The only way I can really describe them is they're like little zingers, and they don't last long, just a few seconds. And actually, I just started having those probably a month ago, maybe?
Yeah.
Within the last month.
Usually about a month to 2 after the surgery, the nerves start waking up and connecting. Even though disturbing is actually a good sign, meaning the nerves are not dead. It is more or less is like when you sleep on your arm and it goes completely numb and limp, and then when it starts waking up, first you feel those fingers going to fingers, and that is the same kind of thing. They are waking up, it's just in slow motion, whereas in your arm, when you sleep on it, it takes 5 minutes or so for that to come back. This can take months, but it's the same process. Nerves are healing, they're reconnecting, they're waking up, and they are telling you that they are there, and that's a good sign.
Okay.
Down to driving.
Yeah, driving.
Well, obviously you have to drive safely. You have to make sure that you have control over your legs. If needed, we can even send people to physical therapy or occupational therapy. But generally, rule of thumb is, if you are not on heavy medication, you can drive. Obviously, if you are on medication, like taking alcohol, you are influenced. It's called driving under influence, not necessarily alcohol, but any kind of thing, medication that influence your, slow down your reflexes and so on. And some of pain medication do that. That would slow you down and make the driving not really safe. But as long as you are not on narcotic or sedatives, you can drive.
And talking about the pain medicine, medication, I wasn't on the pain medication very long after the surgery.
Yeah.
I basically just had Tylenol, and that was it.
So how long after the surgery? Usually people telling me that they have been on pain medication for years before the surgery. We do the surgery, usually within weeks they're off medication. How long did it for you to come off medication?
Oh, it was probably a month, no more than a month and a half, I think.
That's pretty good, actually.
The last prescription you got was right about Thanksgiving.
Wow,
Yeah, it might
that
have
is
been.
that's
Shortly
pretty
after, a
good.
month after surgery.
Yeah.
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 So,
Excellent. Your questions are fantastic. Let's keep going.
okay. I was asking about traveling, how far I could travel.
Most of the time, the travel is not the problem, but how you travel is more of a problem. Like, do you have to carry luggage? Are you going to a 2,000 miles car trip and so on? Generally, many of my patients travel from all around the country, even more to me. They get the surgery, and 4 days later, if they are prepared for that, if somebody helping them with the logistic, they can fly back and so on. The answer about traveling is about how you are going to travel, what are you going to do. As long as you stay within our limitation, traveling itself is not a problem. It's about how you travel.
Okay.
And how I tolerate it, I'm sure.
And specifically, if you're going to go on a big ride, do few small rides, see how your body agrees with that before you go on a 2,000 miles drive.
Right.
Okay?
Right.
Before we go to Alaska.
Yeah.
That's a good one.
That's our dream vacation.
Well, let's keep it. Let's keep it going, and let's prepare you for that.
Okay. Sounds good. And then I was wondering about my weight restrictions.
Yeah. Now, there is a booklet we give to everybody about the limitation, and most of that is common sense, but it's about no bending, twisting, lifting, and you have to learn, obviously, those activities in a controlled way. And physical therapy, occupational therapy, they will teach you how to do certain things, like putting a socks on. There are different ways of doing that.
Right.
Regarding weight restriction itself, generally, that's just a rule of thumb. 8 pounds for the first 2 weeks, 15 pounds for 2 months, 35 pounds for 6 months. And generally, we don't want you to go over 35 pounds until we see bone growing together. But at that point, we just have to adjust it to individual situation. Meaning that if you feel good, you do a little more, watch yourself for a day or 2 or 3, then you go a little more until the pain makes you stop, and always let the pain stop you. Pain is a signal that your body doesn't like what you do. It's in trouble. It wants you to give it a rest. Don't try to work through the pain.
Yeah. Okay.
And even more important, don't take the pain medication so you can go and do things that would be painful without pain medication.
Yeah, that doesn't make sense. Yeah.
I have an analogy for that. I can numb up your hand so you can go and pick up a hot coal.
Wow.
You won't feel it, but you still will burn your hand. But my medication will make you not feeling it, so that put you at the danger of literally burning your hand to the bone.
Right.
So same with pain medication. Yes, we want you to be comfortable. Take it to be comfortable, but don't take it so you can go do things that would be otherwise painful.
Right. Okay. Let's see. I think that was it, except for I asked you about maybe doing more physical therapy.
Yeah, and that is important very early on to do physical therapy, to learning how to do certain thing in certain way that is less stressful to your back. That's a routine for all our patients. Now, this has been very educational. Thank you so much participating and helping my other patient to have their questions answered.
Thank you. We're happy to do it. Thank you.
Thank you very much. I appreciate that.